Hi everyone, welcome back. So if you have watched a couple of the recent videos I posted about the use of massage in pregnancy and also in the postpartum period, you probably heard me mention that I was going to do a video on self breast massage to assist with breastfeeding and to promote milk flow. So that's what I'm going to be talking about today. I think it's pretty well known that there are numerous benefits of breastfeeding your baby. And certainly it's something as a midwife I got used to hearing my colleagues really kind of promote the breastfeeding route. But, for a lot of women, breastfeeding actually may not be the best option or just isn't right for them. And that can be for a variety of reasons, from medical issues or illness. Maybe it just doesn't fit in with their lifestyle and their work so well, if they're going straight back to work. And sometimes there might be psychological aspects to it, and some women, for unknown reasons, it just doesn't work for them. So I just want to emphasize really before I start on the demonstration that too many women are kind of being pressured into breastfeeding and being made to feel like if they don't breastfeed their baby that they're somehow failing as a mother, or they're not doing the best for their baby. And so I just want to sort of start by saying to those women, please do not feel like you're doing something wrong if you are unable to breastfeed, or if you don't want to breastfeed. You have to do what's right for you as well as for your baby. Whether or not you breastfeed, that is not going to mark your success or failure as a mum. So, just look at the options and decide what is right for you. So for the video today, I want to talk about the use of self-massage, because massage can be effective not only in easing the physical and emotional transition into motherhood, but also promoting breastfeeding and milk flow. So I'm going to explain and demonstrate how to do a self-massage at home in order to basically improve lactation and promote, the flow of milk, and hopefully help you should you decide to breastfeed, or should you be having any difficulties. Hopefully this will, help make things a little bit easier for you. So self-massage can be used, I'd say more so in the first few weeks postpartum. The idea is to do it, briefly, sort of before you do each breastfeed. There are a few benefits to doing this. Obviously, we're aiming to increase milk production and obviously the actual flow of the milk. But also it aims to increase the blood circulation around the breast tissue, to prevent breast engorgement and mastitis, which if any of you have had, you'll know breasts become very hard and painful, really just does not make for a happy breastfeeding experience, or for a very happy general feeling. And so if you do self-breast massage, it can certainly help. We know massage helps with relieving pain. Breast massage likewise can help relieve the pain associated with mastitis. It can also help to improve with newborn suckling. If if baby's having problems latching on, sometimes just having that improved milk flow, and obviously if you're relieving any pain that you have, you're going to be more relaxed, and that just helps baby to latch on as well. But one other thing is that's actually been shown in research is that breast massage actually also helps to reduce the amount of sodium or salt in the breast milk as well. So, so a few benefits there. So the other thing to know is that when you do a self-breast massage, it should be quite a gentle thing, and it shouldn't be painful. Now, obviously, if you are starting to sort of get some mastitis, you probably are going to be a bit uncomfortable when you first do it, but hopefully, once the breast massage gets sort of underway and you're sort of doing it quite regularly, hopefully, the pain should be eased, and that sort of discomfort would subside. So, okay, so I'm now going to proceed with a demonstration to show you how to actually do this self-massage. So, for this demonstration, I am going to get my boob out. Here it is. And just sometimes it's easier to have a bit of a picture rather than just me saying what you need to do. So what you're going to do to start this self-massage is you're going to hold the breast tissue horizontally between both hands, okay? And you're just going to gently move the breast tissue, all that glandular tissue, backwards and forwards, like that, okay? And then what we're going to do, we're going to repeat this step, but instead we're going to move the hands and we're going to hold the breast tissue vertically. And again, we're just going to move the breast tissue backwards and forwards. Okay. Now, once you've done those two steps, you're going to, with one hand supporting underneath the breast, you're going to then massage the glandular tissue with 3 fingertips, and we're going to go all the way around the breast in a circular motion. Okay, and we're going to go right the way around using these circular motions to just stimulate the milk flow right the way around, okay, until you've covered the whole breast area. And then following this step, we're going to gently stroke from the base of the areola to the nipple with the fingers. And again, we're going to work right the way around the whole areola, just stroking from the base inwards. And then we're going to position the areola. We're going to put the thumb and the forefinger behind the areola, and we're going to gently press towards the chest. Now at this point you may notice that milk will start to appear, which is a good thing. That's what we're working on. Okay, just press towards the chest. And then you can then return back to the previous step where we're just stroking towards from the outer edge of the areola into the nipple, just stroking inwards. You can do that stage again all the way around, and then again gently press in. Okay, now by this time you should probably have noticed some milk starting to flow. But you can, as I say, just revert back and continue those steps a few times, by which time you should hopefully see the effects of the massage and be able to go ahead and breastfeed, hopefully without any issues. So that is a bit of a brief video, but that is basically your self-breast massage for breastfeeding. So nothing too complicated. It's quite basic but quite effective. And like I say, if you're still unable to breastfeed, don't beat yourself up about it. You're not on your own. There are lots of women that, as I say, for whatever reason, it just doesn't happen, and that's okay. It doesn't make you a bad mum. Yeah. But so yeah, there will be more pregnancy related videos coming up, and if you want to be notified when they come out, then subscribe to my channel. And I will be doing one on postnatal depression and also SPD, so they'll be going up shortly. And as always, you can comment down below or contact me through my Facebook or Instagram, and I will do my best to answer any queries that you have. But for now, that's it from me. So good luck with practicing your massage, and I will see you next time. Bye.